Good evening, folks. Tonight's topic B: when technology makes healthcare more human. In the quiet hours of the morning, before the hospital fully wakes, a nurse reviews patients she may never meet in person. A man with COPD in rural Pennsylvania has dipped into the yellow zone overnight. A woman recovering from heart failure shows a subtle upward trend in weight. These aren't just numbers, they are stories. Early warnings, small cries for help, signals that allow care to begin long before a crisis erupts. This is the new face of healthcare. Not futuristic, not flashy, but profoundly human. Technology is transforming healthcare not by replacing clinicians, but by returning us to the kind of medicine we always meant to practice. Proactive, attentive, continuous, and centered on the patient's lived experience. The center of care has moved and patients feel it. For a century, healthcare revolved around the hospital. The patient traveled to the clinician, and care happened episodically in short bursts of attention, separated by long stretches of silence. Today, the center of gravity has shifted. Remote monitoring, telemedicine, and connected devices have turned the home into an extension of the clinic. A frail older adult can remain safely in their living room because her health care team sees what her body is doing in real time. A patient with diabetes learns more from a continuous glucose monitor than a dozen office visits. A teenager with anxiety can talk to a therapist without leaving her bedroom. Technology has made care continuous, not intermittent, rational, not transactional, predictive, not reactive. This is not a technical achievement, it is a moral one. AI is not replacing clinicians, it's restoring them. The headline often gets this wrong. AI is not here to supplement clinical judgment. It is here to support it. Radiologists using AI catch cancers earlier and more accurately. Primary care physicians use predictive analysis to identify patients at risk for heart failure or sepsis. Primary care physicians use predictive analysis to identify patients at risk for heart failure, sepsis days before symptoms appear. Natural language processing lifts the assistive burden that has been quietly eroded clinician joy for decades. AI is becoming a second set of eyes, a second listener, a second thinker, never the first. It is a tool that expands human capability, not a threat to it. The real transformation is this: clinicians are getting back time, time to listen, time to think, time to care. Telemedicine has collapsed. Distance and dignity has followed. In rural communities, distance has always been telemedicine has collapsed. Distance and dignity has followed. In rural communities, distance has always been a barrier to care. Technology has finally begun to dismantle it. Telemedicine allows a caregiver to join an appointment from work. It allows a parent with mobility challenges to receive specialty care without navigating icy roads. Inaccessible buildings, it allows continuity of the most powerful predictors of healthcare outcomes to flourish. Patient with mobility challenges to receive specialty care without navigating icy roads or inaccessible buildings. It allows continuity, one of the most powerful predictors of health outcomes, to flourish. But telemedicine's greatest gift is not convenience, it is dignity. Patients can seek care without shame, without logistical hardship, without feeling like a burden. For many, the screen becomes the doorway to a healthcare system that once fell out of reach. Wearables and Biosensors are rewriting the patient role. For generations, patients were passive recipients of care. They waited for symptoms, waited for appointments, waited for answers. Wearables have changed that. A smartwatch detects atrial fibrillation. A smartwatch detects atrial arterial fibrillation before the patient feels a flutter. A sleep sensor identifies apnea in the quiet hours of the night. A continuous glucose monitor teaches a person with diabetes how their body responds to stress, food, and sleep. Patients are no longer passengers, they are the participants, co authors of their own health story. The healthcare, the health system itself is transforming. Behind the scenes, technology is reshaping the infrastructure of care. Interoperability is stitching together fragmented records. Automation is reducing administrative load. Predictive analysis are helping hospitals prepare for surges. Hospital at home models are proving that acute care can be delivered safely outside traditional walls. These changes are not about efficiency for its own sake. They are about building a system that is responsive, coordinated, and humane. But transformation without equity is just another form of harm. We must confront the risk honestly. Algorithms can inherit bias. The digital divide can widen inequities. Privacy can be compromised. Technology can overwhelm clinicians if poorly integrated. The promise of healthcare technology is intense, immerse, but only if we build guardrails strong enough to protect the people we serve. This is where policy must lead. Policy agenda for a more human free future. to ensure technology strengthens, not fractures, our healthcare system. We must commit to equitable access, broadband devices, and digital literacy as core health infrastructure. Algorithmic transparency, mandatory bias testing, and public reporting. Clinician centered design, technology that reduces burden, not adds on to it. Data governance, privacy protections, must match sensitivity of health data. Reimbursement reform, payment models that reward proactive, continuous care. Technology alone cannot make healthcare humane, but policy can ensure that it does. The future is not about machines, it's about people. If we steward this transformation wisely, technology will not make healthcare colder or more mechanical. It will make it more human. Technology will not make healthcare colder, more more mechanical. It will make it more human. It will allow clinicians to practice the kind of medicine they imagined when they first put on a white coat. It will allow patients to feel seen not only in the exam room but in the quiet hours between. It will allow care to follow people into the places where life actually happens. The future of healthcare is not a machine, it is a relationship, strengthened, supported, and extended by technology, and that future is already here. Storytelling with a system level insight, policy relevance, and it's structured to help you adapt for multiple audiences. In every exam room, every ICU hallway, every quiet home where a patient recovers after a long night, a new kind of intelligence is emerging. It does not wear a white coat. It does not speak in the warm cadence clinician of a clinician, but it listens deeply, continuously, and without fatigue. It watches for patterns the human eye cannot see. It remembers every patient, every friend, every anomaly. This intelligence is not artificial, but its impact is profoundly human. AI is transforming healthcare not by replacing clinicians, but by restoring the conditions under which good medicine thrives: time, clarity, anticipation, and connection. The new clinician, the new clinical partner, AI, as a second listener, not a second doctor. Clinicians have always relied on pattern recognition, subtle cues in a patient's voice, the faintest shadow on a scan, the story that doesn't quite fit. AI extends that intuition. It reads radiology images with tireless attention, flagging early cancers that might otherwise hide in plain sight. It monitors vital signs for the quiet drift that precedes sepsis. It analyzes millions of patient histories to predict who is at risk for heart failure, stroke, or deterioration long before symptoms appear. AI does not replace clinical judgment, it amplifies it. The transformation is not about machines becoming doctors, it's about doctors gaining tools that let them practice medicine with greater precision and less burden. Okay, guys, that is it for tonight. I will see everybody tomorrow for shows. Until then, Gator Wellness. Take care, guys.